First, let's look at the top 10 symptoms. Sudden numbness or weakness. This often affects the face, arm, or leg, especially on one side of the body. If you or someone around you feels this, it's very important to act quickly. This numbness can be a sign of blood flow to the brain being blocked, which can cause brain damage if not treated right away. It usually starts suddenly, and the numbness may come with a tingling feeling. Do a quick self-check. Try to smile, raise both arms, and say a simple sentence. If you have trouble doing these things, get medical help immediately. Confusion or trouble speaking. Having difficulty speaking or understanding speech can be an early sign. This might show up as slurred speech or not being able to find the right words. These symptoms happen because the parts of the brain that handle language are affected. People may also have trouble reading or writing. Pay attention to small changes, like using the wrong words or making incomplete sentences. If you think someone is having a stroke, ask them to repeat a simple sentence. If they can't do it, they need urgent care. Vision problems. Sudden trouble seeing in one or both eyes, like blurred vision or complete loss of vision, can happen. This occurs when the stroke affects the part of the brain that handles seeing. Vision issues might include double vision, loss of sight vision, or seeing flashing lights. These symptoms can be short-term or long-lasting and might be mistaken for less serious conditions. A healthcare professional needs to check right away to see if a stroke is the cause and to prevent more problems. Severe headache. A sudden, very bad headache with no clear cause, often described as the worst headache ever, can be a sign of a bleeding stroke. This kind of stroke involves bleeding in the brain and needs immediate medical attention. The pain may come with a stiff neck, face pain, confusion, or vomiting. It's important to tell this apart from regular migraines, as the sudden and intense pain is a key difference. Quick emergency response can save lives, since bleeding strokes can get worse quickly. Dizziness or loss of balance. Sudden dizziness, loss of coordination, or trouble walking can mean a stroke. These symptoms happen because the brain can't control balance and coordination when blood flow is blocked. People might feel a spinning sensation, called vertigo, have trouble standing, or feel unsteady. Observers might see a sudden change in how they walk or stand. These symptoms can cause falls and other injuries, so getting medical help right away is important. A detailed checkup by a doctor can find the cause. Sudden confusion. Suddenly feeling confused or not knowing where you are can be a sign. This might involve not recognizing familiar people or places, and happens because of problems in the brain's thinking functions. The person might seem dazed, have trouble focusing, or struggle to follow simple directions. Memory lapses or not being able to remember recent events can also happen. Such changes in thinking are serious and need quick medical evaluation to see if a stroke is the cause and to start the right treatment to prevent more brain damage. Trouble with coordination. Having trouble with coordination and balance, making it hard to walk or do everyday tasks, can be a warning sign. This often comes with dizziness and shows problems in the parts of the brain that control movement. Small motor skills, like buttoning the shirt or holding a pen, might not work well. Sudden clumsiness or not being able to do normal activities without falling or stumbling is a red flag. Physical and occupational therapy might be needed after a stroke to regain these functions, but early help is key to reducing long-term effects. Difficulty swallowing, trouble swallowing, or dysphagia can happen. This is especially dangerous as it increases the risk of food or liquid going into the lungs, causing aspiration pneumonia. Patients might cough or choke while eating or drinking, and their voice might sound wet or gurgly after swallowing. They may also feel pain or discomfort while swallowing, leading to not getting enough nutrition and hydration. Quick assessment and help from a speech-language pathologist can reduce these risks and improve swallowing. Fatigue, unexplained, sudden fatigue or exhaustion, even without physical activity, can be a subtle sign. This happens because the brain struggles to work properly with limited blood supply. The fatigue might come with a general feeling of weakness or heaviness in the limbs. Patients often find it hard to stay awake or alert, and may need frequent rest. Knowing that this fatigue is not just tiredness, but a sign of a serious condition, can lead to quicker medical help and proper treatment. Nausea or vomiting. Sudden nausea or vomiting, especially when combined with other symptoms, can be a sign of a stroke. This happens because the brain is reacting to abnormal conditions. These stomach-related symptoms can be misleading and are often mistaken for less serious issues like food poisoning or a stomach bug. However, when they come with neurological signs like dizziness or headache, They should cause immediate concern. Quick medical evaluation is necessary to see if a stroke is happening and to start life-saving treatments. Here are the first main signs of a stroke. These are all critical warning signs, and recognizing them can be life-saving. Special proven supplements can improve the quality of neural connections in the brain. I will leave the link in the description. Like this video and move on to practical tips for prevention. Recognize fast. Remember the acronym FAST. Face drooping, arm weakness, speech problems, and time to call emergency services. Knowing these signs and acting quickly can save lives and make outcomes better. Practice the FAST check often so you can act quickly and effectively in an emergency. Know your family history. Learn about your family's medical history related to strokes and heart diseases. Tell your doctor about any family history of strokes to better understand your risk and create a prevention plan that fits your genetic background. Heart-healthy diet. Focus on eating foods rich in omega-3 fatty acids like salmon and flax seeds to support heart health. Include lots of fruits, vegetables, whole grains, and low-fat dairy. Avoid trans fats, too much salt, and added sugars to keep your blood vessels healthy. Intermittent fasting, which I made a video about, will help with this. Avoid tobacco products. Using tobacco greatly increases your risk of stroke by hurting blood vessels and raising blood pressure. Both smoking and being around smoke can lead to atherosclerosis, where arteries harden and narrow. Quitting smoking helps heart health almost right away, and there are many resources to help you quit. This also applies to alcohol. Regular checkups. Regular medical checkups can help find and manage risk factors early. Schedule yearly physical exams and blood tests. Keep your blood pressure in check because high blood pressure is a main cause of strokes. Use a home blood pressure monitor to regularly check your readings. Finding conditions like high cholesterol or atrial fibrillation early can lead to timely treatments and lower your stroke risk. Stay informed. Learn about stroke symptoms and the importance of quick action. Join community health programs and attend informational meetings. Share educational materials with family and friends, and encourage them to learn the FAST acronym to help recognize stroke signs. Maintain a healthy weight. Being overweight increases stroke risk, so aim for a healthy weight. Follow a balanced diet full of nutrients and low in unhealthy fats and sugars. Combine this with regular exercise to maintain or reach a healthy weight, which can lower your risk of high blood pressure and diabetes. Remember, I have a video about intermittent fasting that can help you lose weight. If you are diabetic, the following advice is for you. Manage diabetes. Keep blood sugar levels under control because diabetes increases stroke risk. Check your blood sugar regularly and follow a diet for diabetics. Exercise regularly and take your prescribed medications. Regular visits to your diabetes doctor can help you manage your condition well. Manage stress. Long-term stress can increase stroke risk. Find good ways to manage stress. Practice mindfulness, meditation, or deep breathing exercises. Do hobbies. Spend time with loved ones and seek professional help if needed. Reducing stress can improve your overall heart health. Make sure you get 7-8 hours of good sleep each night and drink plenty of water throughout the day. Take medications as prescribed. Follow your prescribed medications for managing conditions like high blood pressure and diabetes. Missing doses can lead to uncontrolled blood pressure or blood sugar levels. Use reminders, pill organizers, or apps to make sure you take your medications regularly and consult your doctor often. These are practical tips that can significantly reduce the risk of stroke. Don't forget that all the links are in the description. Watch the video about intermittent fasting or at least click the like button